So my name is Sarah, and I am with the Veterinary Hospitals Association. I'm the Director of Events and Product Marketing, and I'd like to welcome Dr. Emily Stein and Lindsay Campbell with Teef, and they're going to be presenting on Protektin 42 and how it will fit into your clinic. Thanks for joining us.
All right. Good afternoon, everybody. I'm Lindsay Campbell, as she mentioned. We're just going to give a quick overview of the new product that's available through your organization, through the VHA. It is a dental care product. So with that, I'm going to start off the presentation and kind of give you a product overview, and then Dr. Stein's going to take over and kind of give you more of the scientific technology side of the product. So I think it's important to understand that this was founded by Dr. Emily Stein, our CEO and our brainiac. Basically, after she had a brush with a very serious health issues that her grandmother and her dog went through because of dental disease and dental care neglect. So a long story short, she basically was able to biohack and take samples of their biofilms and find generally recognized as safe human-grade ingredients that would work together synergistically to balance the oral microbiome. She is also a presenting subject matter expert and key opinion leader on microbiome-related science and research, presenting at some of these events that you see down below. As you know, I'm sure, dental disease is prevalent. It is in 85% of cats by the age of 3, 80% of dogs by the age of 3, and humans by the age 30, it's around 50% of us. And then it, of course, increases as our age increases. So there's something that can definitely be done better. The problem with obviously dental disease is that it causes a lot of downstream effects that are negative. And we're learning every day that it's more and more, but we're already very familiar that it's associated with cardiovascular disease, kidney disease, joint arthritis failure. There's even, evidence out there that it's causing dementia, problems that are obviously very, very dangerous. So this is something that, usually dental health and overall health seem to be kind of siloed, but it's very clear that these are very closely linked. So even if you have dental disease, it can lead up to a 30% shorter lifespan, especially in dogs. So the root cause of this, and Dr. Stein will go into this in a little deeper in a few slides, but it is dysbiosis. It's the imbalance of harmful bacteria over beneficial bacteria. And current approaches that are being used are basically ineffective at preserving the beneficial bacteria essential for dental health. The current approaches, modalities are physical disruption, dental cleanings, brushing, and chewing. All those are great and highly recommended as a mechanical displacement of bacteria and biofilms. Bacteria will reattach in about 2 minutes. So you're addressing the bacteria temporarily, but you're not changing what they do and how they behave. Chemical treatments are much the same. Antibiotics and antiseptics will kill bacteria, but they'll still grow back at the same rate, with the harmful still outnumbering the good. And of course, resistance is something that's popped up lately as well and been there for a while. The product is Protektin 42, and that's our formulation. It is a prebiotic water supplement for canines. The name Protektin 42, just as an FYI, is because dogs have 42 teeth in their adult mouths. So we're trying to protect those 42 teeth for the lifetime of the animal. But you'll see that this is the pouch that these two elements come in, plus a little spoon that you can dose with. Features. This is really a natural human grade, non-toxic solution for your clients. It's at-home care, tasteless and odorless, low calorie. It's kind of there's different application options you can also recommend too. So it's not just limited to a water additive. You can supercharge a toothbrush with it. Some people put it on, a cloth and they'll wipe down the dog's teeth. Some people have even put it in spray bottles. And so, I mean, you can get creative with it, which is great. but the regular administration of it is what's important. And you'll see over on the right that there are 4 main ingredients. That's all it is 4 ingredients. The cyclodextrin, which is a soluble fiber, L-arginine, which is an amino acid, of course, and then vitamin B6, which empowers protective bacteria. That is one of the ingredients that will actually turn the color of the water slightly yellowish because of that vitamin. And then sodium bicarbonate, of course, a very small amount of that, but to neutralize the acid that already exists in the mouth and whiten teeth for that matter. So the benefits of this are that it improves the oral microbiome first and foremost, meaning it's stopping the growth of harmful bacteria and encouraging the growth of beneficial bacteria, which can balance the immune system, promote healthy plaque, and promote healthier gum tissue. Most of your clients will notice first that it improves breath because we are stopping the growth and the behaviors of those smelly byproducts that are coming out of bacteria. Again, I'll let Emily address that. The scientists take that one, but it also promotes stronger and whiter teeth. Of course, it's easy at-home dental care, and then it's not contraindicated, meaning that it's very safe with other medications or other, I guess, what else would you say, diseases, things like that. But of course, we always ask clients to consult their veterinarian just to be sure that there's nothing bad there. So instructions for use. This is, when you read through this, you may think it doesn't make a ton of sense, but our theory behind this and our findings have shown that I think it's first important to understand that we're not dosing the dog, we're dosing the bacteria. So when we say dogs that are raw fed and under 10 pounds, we want 1 scoop and up to 4 cups, which dogs over 10 pounds, we want 1 scoop and up to 8 cups of fresh water. So the reason behind that is these smaller dogs tend to have very crammed mouths, higher bacteria burden, and drink less water. So we recommend a higher concentration for those animals, as well as raw fed dogs, because they don't drink a ton of water either. And then obviously, so 10 pounds, that's going to be 1 scoop and up to 8 cups. It's, a lot of people have multiple dog homes. What we recommend is putting a couple scoops in a pitcher of water, storing it in the refrigerator, and topping off water dishes throughout the day. That helps preserve the supply. And of course, always a question that comes up is whether it's safe for cats, and it definitely is. No problem there. In fact, some people say that it is working for their cats, which is great. But it's important to note that it's not optimized for their oral microbiome because they have a different microbiome than canines do. But we are looking to release that in the probably toward the end of the year, realistically. So this is just something to note that every dog is different, and the results timeline will vary per dog. And there's different factors that come in on age of the animal, how severe their dental disease is, their breed, their size, their diet, how much water they consume. And then there's also owner initiative, which is brushing, dental cleanings, how active are they and trying to maintain that. So it is, it's a learning process for some people. We give the basic kind of overview and recommendation, but you can kind of adjust that as you see the needs of your client. But the results, of course, are improved oral microbiome. And I put an asterisk next to that because we have friends over at the company called Animal Biome, and they actually have an oral microbiome testing kit that they can get on and discount if they actually want to see that it's working on the microbes. But the other things they'll notice are, of course, what I mentioned before: improved breath, pinker gums, and whiter teeth for the most part. But with that, I'm sure you guys want to hear about the science, so I'm going to go ahead and hand it over to Dr. Stein to kind of go a little bit deeper in the weeds to explain the technology behind our product.
Okay, so Protektin 42, as Lindsay mentioned, comprises only 4 simple ingredients that are easily digestible by the bacteria. We're not dosing the dog, we're dosing the bacteria. And so this is a slide that just depicts an exemplary swab that So at baseline, we swabbed a dog's mouth. You can see what grew up, a ton of fungus and a ton of E. coli and salmonella and enteric bacteria galore at baseline. And then within as little as 5 days, drinking water with teef in it, you can see we got rid of the fungus, we got rid of the enteric bacteria, but we were able to maintain and in fact, maintain the beneficial microbes that were actually able to flourish under those conditions. And this is a representative. We've done over 189 dogs, followed them through multiple different dosing studies and different breeds, different types of feed, you name it. The trends are all very similar. Next slide. So really at the heart of what we're doing is the technology is called SMART, which is selective microbial metabolism regulation technology. That's a mouthful, but really this is why we're different. We took a very different approach to try to tackle the oral hygiene crisis in humans and in animals. And a lot of that has to do with the fact that if you really truly want to get change induce change in the mouths of animals, you really have to talk the language of microbes. And so they, just like actually human children, really understand sugar or sugar byproducts. And so what we've done is we found naturally safe combinations of ingredients that act as both an inducer of behavior or metabolism we want to have happen in the mouth, and then also disruptors or inhibitors that block certain kinds of metabolism we do not want in the mouth. It can happen. It's fine if it happens in the lower GI tract. It's neutral activity in the lower GI, but in the upper GI, in the mouth area, it's associated strongly with dental disease in mammals. And so we're using that, both the vitamin B6 and the amino acid called L-arginine, in combination as a prebiotic that work in synergy on the beneficial bacteria that inherently reside in that dog or cat's mouth. And then those bacteria then take that and degrade protein from the diet of the dog into healthy things that actually stop the inflammatory process, such as butyrate, but also creates more of an alkaline environment within the tissue. The key is below the gum line where dental disease starts and persists. And then also stimulates and induces the growth of the beneficial bacteria. That's all happening at the same time as we're using cyclodextrin, which Lindsay mentioned, which is a fiber. And that literally blocks the ability of fungus and certain streptococcus species and other organisms from eating carbohydrate. Because when they stop eating carbohydrate, you basically knock down the all the pathogenic and inflammatory nutrition web that occurs below the gum line and in the mouth to really decrease the food for the bad bacteria and the pathogens, and blocks acid production and things that cause inflammation. Next slide. And this is just some of the examples of the studies we've done. I won't exhaust you, but we've looked at, we do want to grow healthy plaque. So I know that we're all trained to think that plaque is bad. In fact, bad plaque is totally bad, but we do want to have a nice thin film of beneficial healthy plaque to inhabit the surfaces and below the gum line, because that'll help protect the mucosal barrier and help regulate the immune response of that animal. And we've shown in as long as a time course study over 30 days and 165 dogs, 4 separate study cohorts, that daily consumption of drinking water with teef in it does decrease the plaque burden, but it maintains a nice healthy level of plaque. Next slide. Lindsay alluded to the fact that we're in collaboration with Animal Biome, which is a sequencing company. They've mainly focused on lower gut with their approach, but they've been working with us now, and they've done an extensive amount of work recently developing a product for oral microbiome. And you can see in these two examples of dogs, exemplary dogs, Charlie and Darwin, you can tell one of the owners was a huge evolutionary biology fan, that on day 0, baseline levels of Charlie and Darwin both had 42% and 16, almost 17% respectively of Porphyromonas gingivalis, which is one of the most predominant culprits of gum disease, also correlated strongly with certain cancers and dementias in dogs as used in as animal models, and then also in human. So this is a really harmful disease-associated bacteria that you can see within 5 days after drinking Teef water, we've knocked that organism down significantly into the single-digit percents in the mouths of these dogs, which is great. But more importantly, we've also started to diversify that oral microbiome within 5 days' time to grow some beneficial microbes, because healthy mouth and healthy lower gut correlates strongly with a very diverse microbiome in those two compartments. Next slide. So these are some time courses of gum disease. I'm sure you've seen way worse than what we've seen, but on the left-hand side is a snapshot of just a 2-week response to daily consumption, daily administration of Teef water to a dog with, as you can see, later stage periodontal disease. By 2 weeks, you're already seeing a significant reduction in the swelling of the gum tissue, and you're also starting to see some of that the switching of transition of the harmful plaque that you see on the teeth into more of a healthier looking biofilm on the surface of those teeth. On the right hand side is a dog who had fairly moderate gingivitis, and as you can see, within 2 months, excuse me, of daily administration of Teef water, that there were only residual sites that had signatures of gingivitis. And to this day now, this dog no longer has bleeding gums when he chews on things like bully sticks, which makes us really happy. Okay, so with that, I don't know if there's another slide, Lindsay. Nope, that's it. Okay, so that's about all we have time for. I don't want to belabor this, but if there are questions, we're happy to answer them.
And I also wanted to mention that, free samples are available. If you want to give it a try before you pull the trigger, go to our URL down there and type in DVM sample. That's DVM sample, and you can get a free sample to try in case you're curious.
Yep, and we do have this product in the VHA warehouse, and it is on promotion, buy 3, get 1 free. And if you do have any questions, go ahead and pop them into the chat box. We'll probably wrap this up in about a minute. All right, sounds like Joan wants to try it. She said it sounds like a great product, and she's thinking about trying it.
Great, thanks.
All right, I'm not seeing any questions come through. So thank you to everybody for joining us. Be sure to check out the events calendar on the VHA website as veterinaryha.org and sign up for another webinar. Thank you, guys.
Thank you.
Thanks.